we're going to be playing around with some active range of motion. This is a way of approaching movement on your yoga mat that uses the internal strength of your muscles to create a stronger connection with your brain. We are really trying to strengthen the mind to muscle connection by being very focused and intentional with our movements. So we're going to be working a lot around the pelvis and the hips today. I have my chair at the top of my mat. I love to use the chair when I'm doing these sort of sequences because it opens up a whole range of different angles of movement. And if you have any issues with your shoulders or your wrists, where being in table pose is a little too much pressure, I have a lot of students who like to use the chair to support their upper body so that you don't irritate those joints. But we'll start out in a very squared off table pose, knee right underneath your hip, arms right underneath your shoulders. And the first thing that we're going to do is bring our awareness to the ring around the pelvis. You can think of that as the pelvic girdle. And we're going to start to roll forward and back. Think cat and cow, but we are isolating that from the waist down. So we're only getting that movement in the pelvis, very specific as we go through these movements. We are focusing purposefully. That is the mindful element of this movement practice. Very sharp attention. So we notice what it feels like to roll the pelvis forward and back and to try not to let the rest of the body follow. We're isolating, feeling where the activation is coming from. So there's our anterior and posterior pelvic tilt. Then we'll play with a little bit of rotation. We're going to lift the left knee and the left foot up and put it down. Lift the right knee and the right foot up. So now my pelvis is slightly slanted. There's a bit of rotation there. And I'm just going to go back and forth, isolating that rotation around the pelvis. It's a small movement, but it really takes a lot of effort to isolate these. And that's the point. That's where we're strengthening that neurological awareness. Okay, take a little break, maybe shake it out. Maybe do a full cat and cow to reset. And then we'll carry on with our very focused movement. We're going to take the left leg back, pretty level with your hip, and then start to press back through that left heel so that it creates extra length through your waist. And what we're doing is creating this lateral movement through the pelvis. And then I'm going to exaggerate that by reaching across the body. I have a wall over here, so I'm kind of reaching toward the wall to make even more space down this side, right above the crest of my hip. So I feel that lateral movement. I'm going to come back to center and reset. The pelvis is square and level. And I'm going to do that one more time. Reach back just through the left side of my pelvis, and then cross that leg over to make even more space. Notice that particular area of sensation. Paying attention to those deep sensations. Coming back to the middle, realigning. Drop that down, shake it out. Okay, try that with the other side. And one of the neat things that you'll notice as we lift the other leg and we start to reach back and lengthen through the right side body, I'll start to cross over to exaggerate that. What you're going to notice as you go from one side to the other is there might be a significant difference in sensation, range of motion, strength, coordination. All of these things can vary very significantly from one side to the other. And we're moving very slowly, so we get to notice all that. Okay, one more time on that side. Leg comes up. Send the pelvis away from you by reaching back through the heel. Cross it over to exaggerate that space down the side body. So often when we do side body stretching, we're always doing it from the upper body. This is a little different because we're initiating that length in the side line with our leg. Good, bring it back, coming into neutral. Shake, shake, shake. Make sure we're not taking any effort with us. We're not trying to accumulate unneeded tension. Okay, so now we're going to sweep the pelvis back and around, and this is our little reset movement to soften. Scooping a few times one way, and scooping a couple times the other way. A little free form. We are training our nervous system to connect and create effort when we want effort, and then to let go of that effort and rest when we are done with it. That's the flexibility that we're looking for in our nervous system. Okay, so let's play around a little bit more with rotation around the pelvis. The left leg is going to come back, kind of level with the hip, and then I'm going to rotate down. Okay, so what I'm trying to do is take this hip and fold it in like I'm trying to touch my inner thigh. And then I'm going to go the full opposite way. I'm going to try to open it toward the side of the room. Rolling it down. It's almost like my hip point is trying to touch my inner thigh on the opposite leg. Opening, opening, opening. Now, one of the key points with this type of mindful movement is that when you feel yourself wanting to rush, slow it down even more. Catch that tendency to kind of want to gloss over and go, I'm going to slow down and focus even more. Because those are usually the spots where our body is trying to cover up a lack of strength, a lack of control, or just a lack of awareness. Okay, we'll come back through neutral, drop that leg down. Try that on the other side. You'll get to see what it looks like from the other side. So you are starting with that leg straight back. The pelvis is very level side to side here. I'm going to drop the right side of my pelvis slowly down, and it's rotating toward my supporting leg. I'm going to open, open, open until it's kind of like I'm trying to turn my sacrum, the back of my pelvis, toward that side of the room. Coming down through level and then rotating even farther to create that downward slope across the pelvis. Find the places in the movement where your body wants to speed up, and that's where you go even slower. And it feels hard, but that's exactly the feeling of creating that stronger neurological connection between our brain and our muscles. Coming back to neutral, nice neutral spine. Maybe give it a shake, maybe a cat and cow. Noticing if you were gripping anywhere else in the body. A lot of times we'll try to use somewhere else to gather strength and control, but we're working very hard on creating specific isolation. Okay, so now we're going to take one knee out to the side. Think like dog peeing on a fire hydrant position, and just opening and closing like that is a wonderful movement for our hip. But then you're going to hold it up at the top there, and you're going to turn your knee down toward the floor. Come back to level, turn your foot down toward the floor like you're going to tap your big toe. So think tap the knee, doesn't necessarily have to tap, but that's the direction you're going in. Tap the toe. We are playing with external rotation and internal rotation at the hip very actively. And if you've never done active rotation in your hip, this can feel super weird, maybe a little bit crampy. Those muscles will sort of rebel because they've never had to work this hard. They've never had to focus this much. All right, so there's your hip rotation on one side. And we get to switch to the other side and see what it's like. Now, we've been on our hands for a little while, so if your wrists are bothering you, you'll see I flipped up onto my knuckles. I'm not still on a flat palm. The other option is to grab the chair too. Totally fine to work like that. So I'll show you the other side in this position. Okay, open and close, dog peeing on a fire hydrant. The next time you open, the shin is kind of parallel to the floor, and we're going to drop the knee down. Maybe it taps the floor. Come back to parallel. Drop the toe down. Come back to parallel. Internal rotation. External rotation. Notice if one feels easy and the other one feels like a ton of effort. But really, all of these movements are small, but effortful. Okay, drop that hip down, lean back into child's pose, maybe a little wide knee child's pose, and we can rock the body from side to side. Okay. We have quite a bit more awareness around the pelvis and the lower back. Now this is where we're really going to come up to use our chair. You don't have to use a chair here. You can do this just kneeling on your own, but I think especially the first time you try this movement, the chair takes some of your balance out of the equation so you can focus more on what's happening in your hip. And what we're going to do are really slow, active step up. From this position, you're going to shift your weight to rest on the right knee. I'm going to start to lift my left leg up as slowly as I can, and I'm going to wobble, and I'm going to struggle, but that's okay. And then eventually I let the foot land, and I might explore a bit of supported movement there. Then I'm going to come back the same way. I'm going to start to lift the foot up and bring it back. Slowly, don't rush. Okay, so you'll feel at certain points you have a lot of control and you might feel like you have your balance really well. And then all of a sudden you get to a certain point where it's just like wobbling all over the place because that's the part where we don't have as much control yet. So that's a normal part of this experience. Just like anything that we're trying to train our nervous system to do, we want to do a couple reps and watch how the body acclimates. Your motor system can actually learn pretty quickly, and you might actually see that happening right in front of you. Okay, when you're ready, we're going to widen our stance a little bit. Instead of stepping straight forward, think like 45 degrees out to the side. So our hip takes a different angle. Slow and steady to pull it in. And then maybe something close, close to a 90-degree angle. You can see how quick I went at the end there. I was not very controlled in that piece of the movement. This is the harder one, so it's gonna feel a little more challenging. Let's see if I can go slower on the way back in. There we go. Okay, so once you work through a couple angles with your active step into lunge, you might feel your opposite hip is really talking to you. There's a lot of effort over on here. So you can use your fist to just gently give some input to that muscle, kind of loosen it up, maybe drop back into a little wide like child's pose and rock from side to side. And then we'll try that same thing on the other side, which might be a very different experience. Okay. Shift your weight onto your left leg, your supporting side now, the weight comes away from the right leg so that we can start to step it forward slowly, slowly. You can use your arms for balance. Ooh. Stepping that foot up to where you would for a low lunge. Take a little movement exploration there, and then right back to it. We're going to try to pull that foot away. So you're shifting your weight back onto your left leg. This is also why I have a lot of padding under my knee to keep that happy. Okay, as slow as you can to bring it back in and place it down. There's a lot of wobbling there. It's all part of it. That's your brain literally trying to figure out, what do I contract? What do I relax? How do I control that movement? It is a brain exercise when we move this way. Stepping back up, maybe going a little wider. It's actually really a brain exercise when you try to talk and do this at the same time. That's my brain exercise today. Okay, so we just start playing with some of that space that you have around you. Straightforward, 45-ish degrees, 90-ish degrees, if that feels like it works for your hip. Every time you do it, ask yourself, can I go slower? Can I create more control with that movement? Maybe going really wide this time, kind of toward 90 degrees. And then bringing it back in. So this is where the chair helps. Even if you just keep one finger on the chair, or you tap that external support just here and there when you need it, can make a big difference in the experience of that movement and feeling like you can manage your balance better. Okay, let's take a stretch back. If you have your chair there, you might want to keep your arms on the chair and sink down. Or you can stretch yourself straight out on the mat and rock your hips from side to side. Noticing if there's any extra awareness around the pelvis, around your hip joints, maybe those deep hip muscles, you feel like you have some awareness in there. And then as you come back up into sitting, what I like to think about is after we do a practice like this, where we're really challenging our movements, slowing it down, getting our brain to focus very intentionally on a specific area, a specific movement, it creates this incredible connection between our brain and our body. So after you do a practice like this, you have literally changed your brain structure. There are connections where there used to not be any connection before, because you explored that new way of movement. You explored control in a way that you don't normally do in your yoga practice. So that's a nice, interesting way to think about this type of active range of motion within your yoga practice. Hi there, I'm Laura. Thanks for being here. If you enjoyed this video, make sure that you are subscribed. You can also head over to LauraGyoga.com to get into our virtual yoga studio. That is our community for healing and self-development through the techniques of yoga therapy. You can join us for meditation sessions, therapeutic workshops, live yoga classes. You can check out the on-demand yoga therapy library with over 400 videos and growing every day. And you can also book a private session to work with me as a yoga therapist. You might want to check out one of these videos picked out especially for you, and I will see you in the next one.